lonely meeting today. Looks like me, myself, and I here. That's okay. We'll record and post this as usual, and you can watch um, whenever you like. So let's begin here. I'll just start right off by sharing my screen, since obviously we don't have any questions from anybody. So we're going to be working through the urinary system anatomy today. All right, let's go here. There we go. All right. So again, you can search for these within the Complete Anatomy app. Go up to search and you can type in the prefix urinary, and then that'll bring up all the slides that relate to the material we're going to be covering here today. As always, get your list of structures. There's a brief intro that Manny typed up. And then I just want to remind you to please reboot your computer before taking a practical. That seems to help. And as always, continue to notify me when you complete a practical and send me your score. All right, without further ado, basic anatomical overview here. Let's start with the kidney. Give me my handy pen. All right, so the kidney is what produces urine. It's about 4 to 5 inches long, and this is where we filter the blood. So blood is going to flow into the kidneys via these renal arteries. And here we're going to review wastes, and then things like salt, water, and minerals. Those are going to be adjusted if needed. About a quarter of your cardiac output goes to the kidneys, and the blood is going to be filtered here many times throughout the day at the level of the kidney. Now, the urine that is produced is going to flow into the ureters from the kidney. Okay, so and then the rest of the filtered blood goes back into the body, and then that urine into the ureters and heads to the bladder, the urinary bladder here specifically. You can check off most of the vocab words we're going to cover here as we work through this lecture today. So you can just kind of check off with your structures list. And then from the urinary bladder, it's temporarily stored here, and then it's going to be released through the urethra. And the urethra is going to be quite a bit longer in males. We'll talk about some specific anatomical differences between the sexes at the end of this lecture today. So that's your basic anatomical overview. Blood filtered at the kidney. We make urine, passes through the ureters, stored temporarily in the urinary bladder, and then passes through their urethra when we expel. Here's a brief look at the anatomy within the Complete Anatomy app. So here we can see the ureters. I'll just draw a line from the structures here. Okay. The urethra, we can't specifically see the urethra here, but this would be the spongy urethra within the male anatomy. And then here we have the urinary bladder. This is male anatomy, obviously. Okay, let's talk specifically about the kidneys then. The kidney is a rather small organ. And let's take a cross section here, and we'll start at the ureter since we mentioned it here. And we'll kind of follow that urine back through the ureter. So the ureter, follow this back, then we can see the calyxes, or the calyces. Okay, so we have a minor and a major calyx. And these basically, the calyxes, they collect the urine that's formed within these renal pyramids. You can see they're pyramidal shaped. Okay. And that urine that's formed flows into the minor calyx and then into the major calyx before passing into the ureter. So those calyxes collect urine from the renal pyramids, and the pyramids are where we make the urine. This middle area where the pyramids are, we call the medulla. And then the outer area of the kidney, we call the cortex, cortex meaning shell. All right, another cross section here. Let's look at the flow of blood. So we'll begin at the renal artery. That comes off of the abdominal aorta, one of the larger vessels we've talked about before. Okay, so blood's going to enter there. Now let's zoom in on a this structure here called a nephron. It's very small. You can see it's spanning the cortex and then dips into the medulla, or that center of the kidney. We'll touch on that in a sec. But notice if we zoom in on this nephron here, and we've blown it up right here, we have this structure here called the glomerulus. Okay, so that's this little ball of capillaries right here. I think Clark said it looks like spaghetti. Okay. So that's your glomerulus. And this is where filtration occurs, filtration of the blood. So we can see that the blood is going to enter that glomerulus here through an afferent arteriole. So I'll highlight it there. So enters through the afferent arrives. And then we see there's an efferent off the other side here, a little difficult to see. Efferent glomerular arteriole, and that drains blood from the glomerulus. So we have our afferent glomerular arteriole, blood enters that glomerulus, and then the efferent where it's going to exit and drain from the glomerulus. This blood is then going to flow into the peritubular capillaries. Point this out on here. So all these peritubular capillaries here. Peri meaning around, and we can see it's wrapping around the nephron structure there. And this is where reabsorption and secretion occur. So that's a broad introduction here, but let's turn back to this nephron and look at it in a little more depth. So here's a look within complete anatomy. And we have the nephron here. I don't think you can actually see as I move my mouse, but I'll highlight it in a second. And there are about 1 million nephron within each kidney, and they again would form the urine. And we have cortical nephron. These are short, barely dips into the medulla. Okay, cortical because the majority of it is within the cortex, and this is the majority of the nephrons. And then we have the juxtamedullary nephron, and this is this really long nephron here. Juxta meaning next to, because it starts a lot closer to the medulla, okay, versus the cortical nephron, which is more up in the cortex. And the juxtamedullary nephron has these long loops that dip all the way to the end of this pyramid. So we can see our pyramid structure here, and they go to the tip of that pyramid, the juxtamedullary nephron. Okay. We can also see the collecting ducts here. And this is where that urine is going to be modified before moving into the calyx. Okay, so here's your minor calyx, and that'll go into the major calyx, and then into the ureter to be passed. All right, so taking a look again at the nephron. So we zoom in on the nephron here, a little bigger right here. Let's specifically look at the glomerulus again. So they have a little box here, and then we're blowing that glomerulus up over here. And this is where we said the filtration of the blood occurs. And we see that as this collection of capillaries, the glomerulus. Okay. And we can now see the afferent arteriole much better than we could before, as well as the efferent arteriole. So remember, afferent arrives. This is the incoming blood supply. And then blood exits efferent via the efferent arteriole. And notice the diameter of this vessel. The afferent is much larger than the efferent. Okay. And what that does is that creates a high pressure environment, and fluid is going to be filtered out here within the glomerulus. And when it's pushed out, it's going to enter this capsule that surrounds those ball of capillaries there that we call the glomerular capsule. You may know this as the Bowman's capsule. And that's going to catch the filtrate, the fluid that's filtered out. So let's follow that fluid now. So we have this high pressure system. We have blood entering here. We're going to push some filtrate out into this capsule, and it's going to flow then into the proximal convoluted tubule. I'll often just refer to this as the PCT. So proximal because it's lying next to the glomerulus here. Okay, so it catches that fluid, and we move into the proximal convoluted tubule, and then we'll move on just to show you where that goes next. So we've moved here. We've have the filtrate that's moved into the proximal convoluted tubule. And then we'll see that we enter into the descending limb of the loop in Henle. We have this little hairpin turn at the bottom. And then we have the ascending limb of the loop of Henle. That's going to move into the distal convoluted tubule, distal meaning further away. So we have proximal next to the capsule, and then distal after we pass through that hairpin loop. And then we move into the collecting duct. Okay. The collecting duct, that's going to then move into those calyxes we talked about, and then that urine or filtrate will pass into the ureter. Now, all along this pathway here, passing through those structures, the filtrate is going to be modified as it passes through them. And that's going to be based upon the body's needs. And we'll talk about that more when we get into the physiology that occurs at the kidney within your lecture component. Another look into complete anatomy here. A few structures I'll point out. So let's see. We can see the glomerular capsule now. And some other things we can see the afferent glomerular arteries. So here will be afferent, arriving, and then the efferent here. All right, some more images from complete anatomy. Here we can see, so here we have our glomerulus and the glomerular capsule. So then coming off of that, we have our proximal convoluted tubule. We have the descending limb of the nephron loop. And then on the other side, we have our ascending limb of the nephron loop. And then that'll move into the distal collecting tubule, and then that'll move into the collecting duct. And then we'll pass into the calyx here, and then into the ureters. Some differences between the male and female anatomy. The male urethra will be divided. So I'm going to point out some structures here that are also on your list. I guess we'll start with the urethra. So with the male, let me point out here, I think they had it labeled. Maybe they don't. Anyway, the part of the urethra that was flowing through the prostate gland here we call the prostatic urethra. That is on your structures list. So that passes through the prostate gland. That would be your part right here. The prostate gland found in males, it helps make the semen a little more alkaline or basic. Okay? That helps the viability of the sperm when it moves into the vagina, which is an acidic, more acidic environment. And then we have the spongy urethra. So we have prostatic urethra because it's found moving through that prostate gland. And then we have the spongy urethra. And it's called that because it's found within the corpus spongiosum of the penis. That's the erectile tissue of the penis. So we have the spongy urethra here. And then, of course, we have our external urethral orifice where that urine would exit the body. Now, if we move over to the female anatomy, you can see we just have a urethra, a short urethra. And then the other thing I'll point out is the external urethral sphincter. So we have that in both male and females, obviously. In males, it's right after the prostate gland. And then we can locate it within the females, right here, this ring of contractile muscle, the sphincter. So I guess some structures I can point out within complete anatomy. Of course, we have our urinary bladder. Here we have the prostatic urethra. So this is found passing through the prostate gland here. And then we have the spongy urethra. And then again, here's that male external urethral sphincter muscle. Okay. I would say, are there any questions? But no one's here. So I will just post this and upload it. I'll send you the link via YouTube, and I'll also post in our Canvas page under the discussion tab. And we'll see you all next week. Will be a review week, and then we'll see you all to finish up with some our final meeting for anatomy.